Couple Week PeakDay podcast, where we discuss fertility and natural family planning with our friends. Today's guest is Sarah Hall. Sarah is a licensed physical therapist and certified strength and conditioning specialist in Cincinnati, Ohio. She's a devoted Catholic with a desire to partner with Jesus, the divine physician, to allow for healing, which transcends the human gift of natural healing. Sarah has taken a keen interest in studying the nature of chronic pain, which demands a whole person approach. This interest led her to found Living Water Physical Therapy in order to openly allow for the further acknowledgement of spiritual influences involved in chronic pain. Sarah is qualified to provide pelvic health and obstetric physical therapy, and through this specialization, she has found a calling to help women before, during, and after pregnancies in order to best welcome new life and to aid in the healing and recovery process. Welcome, Sarah, to the PeakDay podcast.
Thank you.
It is so nice having you. This is it's a great topic, and it's probably a topic that is not spoken about a lot. Would you agree?
Yeah, for sure. It's one of those things that I think clinically we're seeing a little bit of a generational shift, whereas like my parents and beyond that generation, it was very much a lot of these things were just taboo topics, not known a lot about. I don't even know that pelvic health was so much happening at all when they were going through labor and delivery and recovery, and I'm seeing a lot more of it, and it's hard from my angle because I'm a little bit, I don't know, a lot of my social media gets tailored for me. So I tend to see many, posts that are raising awareness of what pelvic health therapy and things like that can do. Not so much obstetric, but there's a rising knowledge of what pelvic floor physical therapy is, and what we can do. So it's starting to shift a little bit with my generation, which is a nice thing.
Yes. Yeah. So many things that, women of an older generation just never talked about is now more and more being spoken of. And I think that can only benefit women.
Absolutely.
Yeah. So many topics.
Absolutely. Mm-hmm.
So let's start from the beginning. What inspired you to become a physical therapist?
This one, I really do wish I had a more exciting answer. And I could always say it was my brother who had a life-threatening ski accident when he was 17. I would have been 12 at the time. Actually nearly lost his life. And thank God he's great now. He had a 4-level spinal fusion. He broke 16, 17 bones, something like that. In the ICU, to the main hospital, a transitional unit, to rehab, to home health, to outpatient therapy. I got to see it all at the age of 12. And I had these therapy ideas kind of even floating in my head then. But if you had asked me along the journey, was that the reason I went into PT? The answer is actually no. Maybe it had a little more influence with that tie than met the eye at the moment, but it would really, I always just had this insatiable hunger for learning about the human body. And that actually also that showed up maybe around 5th or 6th grade. And that hunger for that knowledge, it never went away. I would find myself in the orthopedist office for like a knee problem, and I'm just like staring at the posters, like trying to absorb what is this thing that is the knee. And that carried on through college. I explored a lot of career opportunities, but I just kept coming back to things in the health, the fitness world as well, in the exercise science world. I actually at one point I wasn't studying that stuff, and I was meeting friends that were, and I was jealous. So that's really how it started. Right. And then it was kind of, honestly, I'm just gonna be perfectly transparent. It was a leap of faith, hoping that I would like the profession. After just knowing that I liked the knowledge and the area. And it ended up being absolutely perfect. Absolutely perfect.
How amazing. And what a gift to kind of have an idea of what you really wanted to do at such a young age. That is amazing.
Yeah, for sure.
Sarah, tell me about your faith journey and how your faith influences your practice as a physical therapist.
Yeah. Um, so that's another evolution that took a turn in the course of what am I going to do with this career? And that actually took a massive turn while I was in PT school. And originally, I wanted to be in athletics, which is how most physical therapists start off when they're in school. They want to do something in sports or, exciting with young people. They're like not wanting to be in a hospital dealing with older people. That's generally how that goes. And then they find themselves, further down the road in PT school, and they learn what else we can do and fall in love with other things. But for me, this is going to sound so out of character for me, but my family and I have a tradition of going to the Indy 500 every year. And so I actually follow that racing series, and I have since I was 13 years old. And people don't realize it, but it's one of the most physical sports out there. It's incredibly physically demanding being behind the wheel of those cars. And so I wanted to be the PT that did all things IndyCar. Like that was the pipe dream originally. Was I went to school in Indianapolis because I was dead set on like, this is my dream. And that's just it was my dream for myself. And I was actually working in a gym, or like kind of interning, shadowing a little bit in a gym where they trained elite full-time IndyCar drivers, and they offered me a job. And I was like, this is it. Like I made it, like this is my dream is coming true. Except at the same time, I was also diving deeper into my faith. And was just kind of at this point of, I have everything I've ever wanted right here, but this is not good for my soul. There was something in that environment where I knew this is not good for my soul. And so it ended up sort of being a thanks but no thanks realization of something where I knew I was going to have to compromise who Jesus was calling me to be. And it was actually a really easy decision because I stopped desiring it. I realized like I want what Jesus wants for me more than I want to sacrifice. I don't want to try and fit myself into this mold. I'm going to have to try and be somebody that I'm not, and try and show them that I'm somebody that I'm not in order to fit into this field. But this isn't who I am. I'm over here. And so I walked away from it, and that left me going into my third year of PT school, having no idea what I wanted to do. And so life ended up leading me back to Cincinnati. That's one of on the short list of things that Jesus made abundantly clear was you're going back to Cincinnati. And it was within 1 year that I started feeling this draw, learning about pain. I had a strong interest in pain, and chronic pain especially, and learning about all of these different influences in pain aside from just the physical injury, realizing that there has to be a spiritual influence with pain, and I cannot address that in the secular workplace. So I realized very quickly the only way that I can truly do my patients justice learning about chronic pain is if I'm bringing Jesus with me. And the only way I can really bring Jesus with me is if I start my own practice. That's it. So it's sort of, as I grew in my relationship with Jesus, it just naturally, it's hard to say other than that. I had to, like, this just felt like something that I must do. Like it felt very much like a duty and a desire, and a calling and a passion all at once.
Oh my goodness. So it's interesting, Sarah, that you had your plans and God had his plans. And
Right.
you were able to discern those plans, and you had the freedom to choose, and you
Right.
chose to follow God's plan.
Right. Right. And he truly did make it easy. Is the really joyful thing. It really, at the end of it all, it was, it's hard to look back at something to say that I felt that passionately about one plan
Mm-hmm.
Um, and especially somebody like me, like I'm like I'm going to go hard after that dream and I will crash and I will burn and I will fall on my face trying. And then I'll still get up and I'll still keep trying, even when it's really clear this is not going to work. Like that's just like etched into my being. So I honestly, like, all I can say, like, it was truly the work of the Holy Spirit that I was just okay with being like, no, actually, that's not, this isn't it. So I tell people, or the way I think I explain it is like, I went to Indianapolis pursuing my dream, chasing my dream, and I left Indianapolis following Jesus's dream for me.
Oh, that's
So,
so. How does your faith influence your interaction with your patients, and how would you say that differs from standard care?
yeah, this was actually something I felt very palpably as a student. Right away. And it was actually more in inpatient settings, like going into hospitals and nursing homes, because there is a very strong temptation and inclination to be just to not be charitable. It's really easy to be, really quick to judge somebody who's struggling with chronic pain as, drug seeking or manipulative or whatever, or, somebody who's just really having a tough time with emotional regulation, to just label them as whiny and difficult. And it's really easy to not be nice to them. And so I saw an opportunity as I was a student, on this faith journey, new on this faith journey too. I'm a cradle Catholic, but I didn't really get that there was a relationship to be had with Jesus until PT school. So as this is all happening in lockstep, I realized very quickly I can walk into a hospital room, and I can even walk into those difficult patients, look them in the eyes, and know that, like, this is Jesus that I'm serving. And being able to have a little bit more patience with them, be charitable, and they are so receptive to it. So I've really tried to hold on to what that student Sarah learned. Not that I'm perfect at it. We were talking earlier that it's, there are weeks where I'm a little bit overworked and it's a little bit harder to do that. And other weeks where I'm realizing like my prayer life isn't in order. And so if I'm not in a good place with my relationship with Jesus, if I'm not putting in that time of prayer, I'm losing sight of all that. It's not flowing over into my interactions. So there very much is like a direct connection between how is my prayer life, how is my work-life balance, and how effectively can I integrate my faith into my practice. And I really I really look fondly upon the Little Sisters of the Poor, because they do this so well. And I got to work when the Little Sisters were in Clifton. I was the PT at their home with those residents. And they would even tell me, yes, we'll go to Eucharistic adoration and everything, but we are adoring Jesus in our patients, in our residents, I should say. So they really understood that, the ministry component. And it can be as simple as just reminding yourself that, like, even today, I had a patient sitting on the edge of a hospital bed at one of my side jobs, and it's so easy to think I just need to get through this so that I can write my notes and so I can go home. But then being able to remember, like, this is a soul, like, this is a precious being created by God. She deserves my time, my love, my respect, my patience. And it just, even just that simple mind shift, it can make a huge difference.
So, how would you say that you partner with Jesus in your practice?
Yeah, so that actually, I have some practical things that looks like.
Mm-hmm.
And some of it is simply where my clinic is located, also where your office is located, the same building where we have daily mass twice a day and 24/7 perpetual Eucharistic adoration, and confession is there on a regular basis. There's sisters walking around. So that said, there's a fantastic opportunity to recognize if somebody is coming in and they have a significant, like we're kind of discerning, like it seems like there is a strong spiritual component to this pain. And sometimes that can overlap with the psychological too. But there are moments where it can be very clear that there is something maybe spiritual at play. I now have a referral source. So I'm also, there are so many ministries connected to the Holy Spirit Center where we're located. And there are even like lay prayer ministry, different prayer ministries that exist that are based out of that building. And I know those people too. And I can call them up and say, hey, I have somebody who's maybe interested in kind of going through, some inner healing prayer to address some things that are coming up. And I always get the patient's permission, of course, before I just start, throwing names around or anything. But they very much become part of this like interdisciplinary team that you don't see in secular hospitals. You have chaplains, which are fantastic. And they're very much part of the team, but it's very much secularized, where you have your doctors, your therapists, your nurses, your social workers, case managers, nutrition, all of that stuff. And my interdisciplinary team includes priests, religious, lay ministers, areas like that as well, hoping to get more connections in the psychological realm. But we're lucky in Cincinnati that we have some good referral sources for that as well.
So you touched on this just a little bit in your answer, but what does a whole person approach look like in practice?
Yeah, and that actually, I could answer that in quite a bit of depth. That actually goes a little bit more clinically into what's happening with chronic pain. And this is actually this is sort of going back to that first year as a clinician experience, and just wondering, trying to learn more about pain and chronic pain especially, and how can we speak to those patients and help those patients a little bit more effectively. And so to give sort of like a depiction of what this looks like is maybe an example of a lady that I had way back. She came to see me a few times when I worked at a hospital-based outpatient clinic. And I don't know that I've ever met somebody who appeared so frazzled and distressed and worried and anxious. And I mean, I can actually still see in my memory, like, I just remember her with her hand on her back, pacing. She wasn't even sitting on my treatment table. She was just pacing. And she was asking questions like, am I ever going to get better? Is this just how it's going to be all the time? And I almost couldn't even get a word in edgewise. Like, she was just so panicked and so anxious. And it's sort of like, it was just this trying to understand, like, what do we do here? Because there's a tendency for these chronic pain patients to just get shuffled between doctor to doctor. Nobody knows what to do with them. There's so much healthcare spending on chronic pain. The doctor doesn't know what to do. The doctor sends them to physical medicine and rehab, where they do some pain management type stuff. They try some things, it doesn't really work. They send them to physical therapy. We tried traditional stuff, it doesn't work. We send them back to the doctor. The doctor goes and gets an MRI. The MRI came out clean. The orthopedist can't do anything. And they're stuck. They're just stuck in this world of chronic pain, and nobody knows what's wrong with me, and I don't know what's happening. What we see with those folks, when they're learning on the science end of this, is there are a lot of changes that are happening at the level of the brain. And they're seeing things for example, our awareness of like discriminatory touch, which is sort of like, am I touching, the base of my thumb or the middle of the bone of my thumb, or am I touching the knuckle, or am I touching here? There's a little bit of a loss of where are all of those different locations. We have a very particular map in each part of our brain that's representing all of these different areas of our bodies. And that it's almost like if you took a pencil eraser and just kind of smudged the lines between all those different spaces. They're seeing there's changes like that are happening at the level of the brain in chronic pain patients. They're seeing things like left-right discrimination is getting a little bit wonky. Things of that nature. They're seeing those clinical changes. And what's happening is the brain is perceiving that uncertainty as threat. And if the brain perceives threat, it's going to output pain because that's our natural response to get out of a threatening situation. You put your hand on a hot stove, and immediately before you can think, you jump away because you don't want to burn yourself. That's our body saying, hey, that's threatening. You're going to burn yourself. Get off of there. We don't even have a second to react to that. And it's doing the same thing. And so if we think about what else is feeding into the brain that's making us feel like we're under threat, there's a lot. There's our thought patterns. That those questions that lady was asking, is this my new normal? Am I always going to be like this? Am I ever going to have a life again? Am I going to die like in 3 weeks with chronic pain or horrible pain and that's it? Those catastrophizing thoughts, that's going to make that can ramp up that pain, that threat response. Lack of sleep is another one. Taking care of yourself, basic food, water, hydration, other chronic illnesses, things of that nature. We're finding that whereas, the general thought is that I have pain, and the direct consequence or the direct cause of that pain is something physical. It's the entire pie chart. It's a physical thing. We're finding that's not true. It's more of like a small sliver is the physical element. And there's all these other things. So the whole person approach can look very much like I'm addressing the spirituality of it, because I really do think that there is a component. If we're going to address sleep and psychology and illness and nutrition and hydration and temperature, and things like that, how can we not address that there's a spiritual battle going on out there too? And that's also going to have something to do with this. But beyond that, I will address those things like sleep, stress, just are you taking care of yourself? Are there areas we can do better there?
You have specialties in obstetric, physical therapist, and pelvic health. Can you tell us a little bit about what does pelvic health physical therapy look like?
Yeah. So a lot of, a lot of really actually so why I went that route was there was one defining moment, and it was when I was still working. I was starting to work towards opening my practice, making moves and things like that, but I still was working a full-time job in a hospital-based outpatient office alongside another clinician who was a pelvic floor PT. And I noticed, at the risk of sounding like there's some profiling going on, I started to notice that the types of patients that she was getting overlaps kind of not even necessarily demographically, but kind of stereotypically with the types of patients that we tend to see in chronic pain. And one of those trends is a lot of them don't show up. They're so overwhelmed with everything that's going on in life. They're frequent no-shows. They have a lot going on. I asked her about that one time, and I said, why do you get so much overlap with this chronic pain demographic and this pelvic floor demographic? Why is there so much overlap? And she said, because a lot of pelvic pain patients are sexual abuse victims. And so immediately I was like, okay, so I need to do pelvic floor because we want those. We want them. We want Jesus to be with them and heal them truly. They need this. So that's actually how I bridged into pelvic health.
Okay.
And so what that looks like, there are a few different directions it can go. It can be very simple. It can be very not related to anything that has a sexual abuse history. That sort of has its own category that it gets lumped into. But the other side of it is, preparing the mom to be as ready physically as she can be for labor and delivery, preventing complications during labor and delivery and postpartum, and then postpartum recovery. And so actually my ideal obstetric patient is going to be a new mom. She's pregnant with her first child. Maybe she's not having any complications at all, but she's hearing about pelvic floor and different things that can happen during pregnancy or down the road postpartum. I would love to just have her come in for a wellness visit, and we're going to screen. We're going to talk about or I'm even going to poke in and say like, are you sure you haven't had any leakage, or anything like that? Because sometimes they'll say, no, 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 except, oh yeah, there was that one time. I was walking all day and then I sneezed and then I just completely peed myself, but that was it. That was the only one time. And for me, I'm like, okay, well, actually we need to address that because one time is one time too many. So I really love to get them on board with preventative stuff. And that can look a lot like recognizing maybe there is some pelvic floor weakness that's starting to rear its head. Here's some exercises to just stop it in its tracks. And then they know me is the nice thing. So if pregnancy progresses and they start to get back pain or hip pain or, sciatica or whatever, they know me. They can just come on in and say, hey, remember me? I'm having some trouble. Can you help me? And then same thing postpartum. So that's really where we can do everything we can do to prevent, but we just never know. You never know what's going to happen in your birth story. And there could have, been a woman who wanted to go completely natural and she had a C-section, or had a prolonged second stage of labor and had a massive tear or something like that. We've got some work to do. And again, at that point, they know me. And it's easier again, I am off the insurance grid. So it gives me a little bit more freedom and flexibility that they can just come see me. They don't have to jump through hoops, and reschedule and do a new evaluation. Then you have to see me for so many visits. You can just come and go as needed. It's really nice.
Right. So you got me thinking about women who are, they've had their children, they're older. What do you see older women, and what are their specific challenges?
Yeah, I do. I don't see them as often. My market is kind of more to a younger population. I do get some older women, and a lot of what we're seeing around there are those perimenopausal, postmenopausal changes that are affecting specifically their ligaments. And it's where we're starting to get into more of like a conversation of managing prolapse. A lot of times that weakness can kind of develop into prolapse as those menopausal changes start to take place. We start to see a rise in that prevalence. So that's another thing that I'm educating my moms on is like, okay, well, if you have weakness, we should address this now. Hopefully they're not already dealing with a prolapse, but kind of in the back of our heads so that we can prevent that. And that is something that is, it's hard because it really does depend on your prognosis depends on how advanced is that prolapse.
Is it important for a woman to be familiar with her fertility, her cycles, and the changes that go through her body, as she is speaking with someone like you?
Yeah, it's tremendously helpful. It's tremendously helpful, and not even so much because of a direct connection with the type of physical therapy that we're doing, but because those women who, of course, I'm a Catholic practitioner, and so I tend to attract Catholic clientele. Those women who are charting their cycles and they know where they're at, they know their bodies. That is probably the single most important thing that I could ever teach a woman is to better know her body. And especially when we're dealing with pelvic floor, I tell people it's so easy for me to teach you how to do a bicep curl because here's your biceps and here's what it looks like. You can see it. But when we're working in the pelvic floor, it's this kind of like deep, dark cave that we can't tell what's going on in. All you have to rely on is what your sensation, what your brain and your body, how they're connecting. Are you aware? Because everybody's like, I don't know if I'm doing it right. I don't know. And that's where I come in and I help them and I can give them feedback on if, yes, they're doing it right. But they have to learn that body awareness piece. And if they're coming in and they've already been charting their cycles and they know where they're at and they know their hormonal profile and everything like that, they already know their body better than most. And they're going to be in tune. I mean, even they're going to be so much more aware, especially through pregnancy as their hormones are shifting and they're getting more ligament laxity. They're aware of those changes. And so it's a lot of it, it's fostering just an independence. And I hate to use the word control, but like a sort of like an autonomy that you have over your own body. or a knowledge that you have of your body and how things are working and how things are integrating. And so that's actually what I find the most is those women who come in with me, they're already so much more body aware. They have such a leg up on everybody else on pelvic health because they just know their body that much better.
For a Catholic Christian woman, what is the benefit of seeing someone like you who is another Catholic Christian for their, physical health, their pelvic floor health?
Yeah. Well, for one, comfort. And I think that goes, I see that trend again among my generation. I'm on all these social media groups where people are constantly asking, does anybody know a NAPRO doctor in Cincinnati or somebody who knows NFP or, it's just Catholic. It's just, there's this desire that Catholic women, especially, they want Catholic practitioners across the board, even if they're not dealing with things that are Catholic. It's just a trend. And it's a good trend,
So do you find that dealing with chronic pain, it's a longer process?
Yes, absolutely. And it looks different for everybody. I have had people that have come to me in horrible pain, and I've seen them for many sessions in a row with little progress. I've seen other folks that maybe came in with years and years of pain, and it only took a few sessions to things just clicked and they got their lives back. More often than not, yes, pain, and especially, and we didn't really talk about this too much, but the pain side of pelvic floor, it gets hard and gray and vague when we're dealing with pain. And again, that body awareness piece is so crucial. Yeah. And a lot of times I find myself telling them, this is hard and it does take time and you do have to be patient with yourself. And it's okay if it feels like none of this makes sense. I find myself having a lot of those conversations with those women, both in chronic pain and pelvic pain and with the overlap.
Right. Well, it's beautiful that you are helping women see that, dealing with their pain in a holistic and spiritual way is a great benefit to them. And thank you so much for being open to God's plan for your life and being able to accept your plans and go with what He had in store for you. That's beautiful.
Absolutely. Well, thank you. Thank you. I appreciate that.
Yeah. Thank you for being on the PeakDay podcast, Sarah. It was lovely talking with you, and best of luck with everything that you're doing with your practice.
Thank you. Thank you so much.